About 700,000 Americans suffer a stroke each year. That's one stroke every 45 seconds.
A stroke is a brain attack that occurs when there's interruption in the cerebral blood supply, resulting in the death of cells and some brain damage. When cells die during a stroke, skills controlled by that area of the brain are lost. The ability to move, feel, speak, or remember can be affected. How a stroke affects a person depends on what part of the brain is afflicted and how much damage results. Ischemic strokes account for about 83% of cases. They occur when clots form within the arteries that supply blood to the head. The blockage of blood results in insufficient oxygen getting to that part of the brain. Ischemic strokes can be divided into two subtypes, embolic and thrombotic. An embolic stroke occurs when a blood clot forms elsewhere in the body and a portion of the clot breaks off, traveling to the blood vessels of the brain. The clot continues its journey until it reaches vessels too small to let it pass. At this point, the clot gets lodged, blocking the blood vessel and causing an embolic stroke. Say the words Richard Nixon and embolic stroke is not what comes to mind. We're more likely to think of Vietnam and Watergate. But Nixon did have a deadly embolic stroke, which occurred when a clot in his heart traveled to his brain. A thrombotic stroke can also be deadly. In this stroke, blood flow is halted due to a local blood clot known as a thrombus, which develops in an artery supplying blood to the brain. Ischemic strokes are the most common type, but hemorrhagic strokes, which make up to 17% of cases, are often more dangerous. A hemorrhagic stroke occurs when a blood vessel ruptures and bleeds into the brain, compressing the brain tissue. Hemorrhagic strokes can be intracerebral, which is more common, or subarachnoid. In intracerebral hemorrhage, bleeding occurs in the vessels in the brain itself. High blood pressure is the main cause of this type of hemorrhage. If asked to recall Franklin Delano Roosevelt, you're not likely to think of intracerebral hemorrhages. But like Nixon, Roosevelt was a stroke sufferer. In fact, a brain hemorrhage led to his death in 1945. The other kind of bleed is a subarachnoid hemorrhage, which occurs when a ballooning of a weakened blood vessel or arterial aneurysm bursts. Blood then spills into the protective spinal fluid around the brain, causing it to be surrounded by this contaminated fluid. If the blood goes into the brain, or if the blood vessels spasm, it can cause a stroke. A stroke is a brain attack. No matter what type of stroke a patient has, it is important to seek medical assistance immediately, as lifetime disability or death can result.
Want to learn more? Check out other videos